Okay, so what exactly is perio charting? Perio charting is when somebody may have some gingivitis or beginnings of perio disease or gum disease. And what the doctor or the hygienist will do is they're going to use an instrument called a perio probe. Okay? And what they're going to do is they're going to stick it down between the gum and the tooth, and they're going to go around it and measure how deep the pocket is. Okay? So it'll measure in millimeters and have little measurements there that they can read. So when they're sticking this down between the tooth and the gum, it's not comfortable. And also what they're doing is they're measuring to see how deep that pocket is. So if it doesn't go very far, if it goes 1, 2, or 3, that's normal. 1, 2, or 3 millimeters are normal. But say it drops all the way down to 5 or 6, that's not normal. How does that happen? If a person's not taking care of their teeth and not brushing and flossing properly, they're going to start getting plaque buildup. And the plaque will get on the teeth, and when it's plaque, you can brush it off easily with a toothbrush. But if they don't get it off, it's going to turn hard and turn into what's called calculus. And once it turns into calculus, what it does is it's stuck on the tooth. You can't get it off with a toothbrush. You got to go to a hygienist to get it removed. And what it does is it will continue to build up, and it will cause the gum to pull back away from the tooth, which will cause a pocket. And if they don't do anything about it and it gets worse and worse, then the pocket will get deeper and deeper. When that happens, a lot of bad things can happen because it can deteriorate the bone, it's going to deteriorate the gums, and eventually the tooth will get loose because there's not much holding it in because the gums and the bone have kind of pulled back away from it. It will cause the gums to bleed easily. It can cause bad breath. A number of different issues that are going to be really bad if this happens. So this is the reason why they do perio charting. You have to remember that the patient is not numb most of the time, so it can be slightly uncomfortable. When you're writing down the numbers for perio charting, you want to make sure that you're getting them correctly. It's very easy if all you're doing is just tapping the numbers on the keyboard, because all you're doing is just have to hit the right number when you hear it called out. But if you're writing them down, you want to make sure that you're getting the numbers correctly. If you get anything wrong, or you think you get anything wrong, stop the person who's calling the numbers out and say, hey, look, where are we at? What number are we on? That way you make sure that you're going correctly. If you don't, what you'll end up doing is getting all the way to the end, your numbers will be off, and you'll have to do it all over again. Okay? So this is the reason why we do perio charting. So there's certain things you need to remember in perio charting. One is that every tooth is going to have 6 numbers, okay? Every tooth will have 6 numbers, all right? The numbers 1, 2, and 3 are good, okay? So you'll write them in blue or black, okay? Any number that is 4 and above, you will mark in red. Those are bad numbers, okay? The next thing is that you're always going to start, well, most of the time, it depends on who's doing the perio charting, but you'll always start on tooth number 1 on the buccal side, okay? So you have your buccal and your lingual, okay? So you always start on the buccal of number 1. Then you'll move all the way to 16, and then you're going to come backwards on the lingual, okay? Another thing to remember is always mark out the teeth that are missing. Okay? What do I mean by doing that? Well, let's say the tooth number 3 is missing here. What I want to do is I want to make a mark here and here. If I don't do that, what I'll end up doing is I'll end up writing numbers on that tooth that is not there, and it will throw all the rest of my numbers off. Okay? The next thing that you need to remember is on the lingual, you have to write backwards. Let's start, let's start with tooth number 1. and we'll say that the numbers for this for these three will be 2, 3, 2. Then I'm going to do 2, 2, 3. Then I'm going to do 4, 3, 2, 2, 2, 2, and so on, all the way till I get to this side. And then I'll say that this one is 3, 2, 2. All right? So going on this way, I was writing this way. But now when I go back on the lingual, I need to write backwards. So, for example, if I said that the first number here was, let's say, 3, 2, 2. I'm not going to write 3, 2, 2 like that. I'm going back the other direction, so the first number that I give will be the distal side. So I'm going to write 3, 2, 2 like this. 3, 2, 2. Okay? And I will keep going all the way back. After I get to this tooth, the next one that I'll do will be down here. And I'm going to work my way all the way to the distal over here and then go back the other direction. Again, when I'm doing this, going this way, I'm going to continue to write backwards. For example, if I were to say that this one is going to be, let's say it's a 4. So 4 would be the first number. 3, 2. The first number I give will be, you'll write that on the most distal side, and then the other numbers, and you'll keep going all the way. Okay? Things to be aware of. If a tooth is missing, say for number 3, usually around there, sometimes the pockets may be deeper. So that's where you'll get the numbers that will be marked in red. Also, if there's a lot of calculus or any gum disease going on, which is the reason why we're doing it in the first place, there may be deeper pockets. That is periodontal.